Hello and welcome to About the House. Hepatitis C affects nearly 250,000 Australians, and it's a disease that often marginalises those who have it. The House Standing Committee on Health is currently undertaking an inquiry into hepatitis C in Australia. Annie Madden is the Executive Officer of the Australian Injecting and Illicit Drug Users League. Annie gave evidence at a recent public hearing and said that injecting drug users are at the core of this issue and that they are the key to minimising the spread of hepatitis C.
The epidemiology of the epidemic is that 90%, over 90% of all new infections are among people who inject drugs. At least 90% of existing infections are among people who have or are injecting drugs. And we don't feel like that issue really has got the traction it needs to have to really effectively address this issue. It's a bit of an elephant in the room, if you like. It's referred to, it's kind of, there's euphemisms about it, but we generally talk about people with hepatitis C rather than saying this is a particular group that's really marginalised and really quite vulnerable, and there are going to need to be very specific initiatives. In particular, we think we need more focus on prevention of hepatitis C. So at the moment, most of the discussion is about the new hepatitis C treatment drugs. They're amazing. Of course they're amazing, and that's fabulous, and we're really excited about that. But we have such a large pool of infection, like nearly 250,000 people have chronic hepatitis C already in Australia, 10,000 new diagnoses every year. That is an enormous problem, and treatment alone, when we have less than 3,000 people currently being treated every year, even with the new treatments, the stigma and discrimination barriers are so significant that it's not going to solve the problem in a short period of time. We need a harm reduction flood, in our view, which is more needle and syringe programs, more peer education, reaching drug users to prevent them getting hepatitis C in the first place, because hepatitis C is preventable.
The issue of needle and syringe programs, or NSPs, in correctional facilities is being investigated as part of the inquiry. Prisons are run by the states and territories, and NSPs are a topic that engenders passionate argument both for and against. Professor Michael Moore is the CEO of Public Health Australia, which is advocating for NSPs in prisons.
Really important, I think, to understand that we've never advocated that that should be run by prison officers. It actually should be done within the health centre, and in fact looking at a model that I saw in Spain where the outside needle and syringe program people came into the prison and ran the program at arm's length from the prison officers. It can be done, has been done elsewhere, and I think that what we need is an open-minded discussion around how we do that and how we balance, on the one hand, the safety of prison officers, and on the other hand we make sure that we minimise the spread of hepatitis C. It's no doubt that spread of hepatitis C in prisons does occur, and there's no doubt that we do have to look at supply reduction, and the prison officers are doing that fairly well within the limitations that they have to operate.
Vince McDevitt is ACT Secretary of the Community and Public Sector Union, which represents correctional officers. The union is opposed to NSPs in correctional facilities, and it raised its concerns at the hearing.
Look, they're many and varied, but basically they pertain to the fact that they believe they will be confronted with more drug-affected prisoners and more hypodermics if the government starts providing them to prisoners. We accept that there will be, illicit substances making their way into the jail from time to time. We don't think that, therefore, is justification to proliferate needle syringes in the jail. We want the government to actually do the work and, look to reduce the transmission of bloodborne viruses through such things as tattoo programs and what have you.
And the inquiry continues. See the House Health Committee website for more details.